Well, thanks very much, Brian. It's great to be back in the electorate of Lyons. This is my third visit here to this town in the last few months. And today is a great announcement. And I want to thank Michelle for hosting us here and thank Ross for coming along as well. Labor will restore a 50% loading for telehealth, psychiatric consultations for people who live in regional and rural communities. This is so important. During the pandemic, we've seen real pressure on people's mental health in particular. And we had this loading put in place, but then it was removed by the Morrison government. It was removed too early, we say. It should never have been removed. It should be a permanent level of support because we should regard people's access to mental health care as no different from if someone breaks an arm, they expect to get treated by a doctor. Psychiatric services dealing with people's mental health, whether they be young people, people who are in the workforce or our older Australians, is an epidemic. We know that we need to do more. And in particular, we need to make sure that you have access to services wherever you live. Telehealth can be so important, and that's why today's announcement is critical. We expect that some 450,000 consultations will take place over the next 4 years as a result of this announcement, with a costing, fully costed, like all of our policies, of $31.3 million over the forward estimates. This is a part of Labor's commitment to strengthen Medicare. We'll have more to say about it in coming days and indeed over the course of the election campaign. But we believe that having Medicare at the centre of our delivery of health services is something that makes Australia one of the greatest health systems in the world. And it's something that we should cherish, it's something we should protect, and it's something that we should strengthen. And that is what a Labor government that I lead would do. And now to Katy.
Thanks, Albo. Morning, everybody. It's lovely to be here with Anthony and with Brian and Michelle and Ross for this important announcement. I can certainly say as a former health minister that the proper funding of primary care is critical if we're going to make sure our health system works. Primary care and aged care are the Commonwealth's responsibility, and they both impact on hospital care. So if you can make sure people are getting the services they need in the community, like mental health care, and proper mental health care with specialists, you can make sure that you're easing pressure on the hospital system. So it's a really important announcement today. We know through the pandemic that regional areas, access and affordability to healthcare was a big issue, as was escalating mental health concerns. So this is one of our policies in terms of strengthening Medicare, but a really important one to make sure that Australians, wherever they live, are getting the healthcare that they need at a time they need it. Look, I just want to make a couple of other comments too. The Prime Minister's been out today on jobs and, a plan of jobs over the next 5 years. We know this Prime Minister has made promises in the past that he hasn't kept, but this is just another promise, not a plan. The Labor Party is actually the only party that's released comprehensive and detailed policies around supporting economic growth and the jobs that will create. And just two of them, like Powering Australia Plan, where we've released detailed modelling, the most detail any opposition would have provided in terms of the job opportunities and the economic growth that comes with that. More than 600,000 jobs, and most of those in the region. So I think that's the issue that we, for the Prime Minister is what are the details, where we are providing all of that detail in our policies. The final issue before I hand to Ross is around the costings that supposedly, these dodgy costings unit that the Liberal finance minister is operating out of his office, completely untrue, wrong, rubbish. I mean, they tried this about a month ago, remember, and they did a big splash and it was apparently costed by the Finance Department, which they then had to crawl away from because the Finance Department distanced themselves and said they had had nothing to do with it. Well, today it's day two. We've got another scare campaign being rolled out. It's just simply not true. The policies, or the so-called policies they've costed, are not Labor's policies. We have all of our policies being costed by the Parliamentary Budget Office, who are able to go through and work through the detail, and we will in the usual way that happens in every campaign, we will be releasing all of those prior to election day. And today is an example of that, where we have a policy. It's been costed over 4 years. So don't listen to the dodgy costing units that's operating by some staffers on the Liberal bus. Look at the policies that we are releasing, the 4-year figures of that, and the costings that have been done by the Parliamentary Budget Office. Every single one of them has gone there. Our costings and our policies are modest, but they are fully costed, and you'll have all that information in the usual course of events as it's provided in campaigns. Thank you.
You're on.
I'd like to emphasise one of the important principles of a fair and modern society is that people should be able to access quality mental health care irrespective of your postcode and your income. Prior to 1st of January, that had been operating for the last 10 years or 11 years very successfully. Telehealth has been a very actively used service in psychiatry delivery to rural Australia, and that was changed without good reason on the 1st of January, whereby item 288 was abolished, which means then that those people on low incomes could not afford the service of seeing a psychiatrist. This policy announcement reverses that bad decision. It is a fundamental principle of fairness and of also a future-looking technology that telehealth is. Telehealth is going to become an increasingly sophisticated and important way of delivering telehealth to all areas of Australia and also around the world. This is going to be a technology that will get increasingly sophisticated with robotics and a lot of other add-ons over the next decades. There is nothing new about telehealth. This was not invented through COVID. This has been we've been very active in this space for the last 10 years, and I'm very pleased to hear this, and I think all of rural Australia should be really very pleased to hear this announcement as well. Thank you.